In this fourth and last video of our Patient Bill of Rights series, we'll go over a few essential patient rights that you should be aware of as you adapt and live with your ostomy or continent diversion. As stated in the first video of this series, counseling, care, and educational instruction should be culturally sensitive and in a language and at a level of understanding suitable for you. Throughout your lifespan of living with an ostomy or continent diversion, it's important that you always have access to healthcare professionals who can help guide you. If you don't have access to care, find a local UOAA affiliated support group, as they might know a certified wound ostomy continence nurse or ostomy specialist in your area. Many support groups are led by WOC nurses. Further, many manufacturers and suppliers have certified WOC nurses on staff that can answer questions regarding care and management of your ostomy. UOAA has a list of ostomy healthcare resources at www.ostomy.org/find-an-ostomy-nurse. As time passes after your surgery, you may experience changes in your stoma or body shape, or have a new medical condition that may impact your ability to manage your ostomy. You also may need to make adjustments to the supplies you are currently using. For example, as someone ages, they may develop arthritis in their hands, which may affect their dexterity and make it difficult to cut wafers or apply a new pouch. In these scenarios, it's important to assess and reevaluate with a healthcare professional. People who have had ostomy or continent diversion surgery can benefit from lifelong learning and emotional support. For example, attending support group meetings is an opportunity to be surrounded by people who may be experiencing many of the same things as you. You are not alone. Many meetings also host guest speakers and showcase new ostomy product information. For experienced ostomates, mentoring others is a chance to pay it forward, share advice, and provide peer support. Many ostomates go through a long trial and error process with their medical team to find a proper fitting and reliable pouching system. Throughout the lifespan of living with your ostomy, you should have ongoing access to the supplies that address your unique medical needs so that your quality of life is not disrupted. Remember, when it comes to products, you have options. When looking at the various options, you should work with a certified wound ostomy continence nurse or ostomy specialist to find the best fitting and reliable pouching system for your stoma. If you're denied access to the supplies you need by your supplier, then it's your right to change to a different distributor who can provide your products. If you are denied access to the supplies you need by your insurance company, then it's your right to file an appeal with a letter of medical necessity explaining your tailored needs and the medical consequences of not having the proper supplies. Be your own best advocate. The Ostomy and Continent Diversion Patient Bill of Rights is not mandated by law, but should be used as a guide for patients and families to facilitate the best outcome for the patient. Healthcare is a human right. If you feel your rights are not being met, speak up, ask questions, share the Patient Bill of Rights, and be as involved in your care as possible. You can be a force for change. Please go to ostomy.org to download the Patient Bill of Rights and get more information about UOAA.